collecting the service. So welcome everybody. Welcome back to Y Senior Virtual Connect. It's so good to see everybody, and I am super excited to see a familiar face. And not far away from us, but Tom Atwood, who many of you have known from Harris, who's done great things. Tom, how long were you at Harris?
About 5.5 years.
Wow, yeah, so I'm sure hopefully you guys have met Tom before, but now Tom is not very far away at an organization that's sort of near and dear to my heart. Tom is a vice president of philanthropy at Hospice and Palliative Care, the Charlotte area region. So I'm super excited to not to have to miss seeing Tom, but to invite him back so Tom can share, or invite him with us, so Tom can share great things that are going on. And I couldn't say enough about my personal experience with hospice and palliative care. And it's just been a life-changing experience with me in this organization. So Tom, let's you tell us all about the depth and the breadth of what you guys are doing there.
Yeah, Jane, thank you. And, thanks for letting me be one of the ladies today. This is definitely really good company. And y'all, I'm going to share, I'll be brief in these remarks, but I wanted to really share what I think are 4 things everybody should know about hospice. And so it's a little bit less about Hospice and Palliative Care Charlotte region, which is the name of the organization for which I work. But this is more of a little broader conversation about the unavoidable, right? And that's at some point, our loved ones and on ourselves will transition on to their next life. And hospice is all about the management of those moments, and those moments that matter as we approach the end of our life, and what is the best quality of life that one can expect and one can strive to have in those final days, weeks, months of life. And so really that's the first lead-in point about hospice that not a lot of people really connect the dots on, and that is hospice is not about dying or giving up. Hospice care is fully about living, and it's built on 2 very important pillars. The first pillar is that you as an individual matter, and that everyone deserves to die pain-free and with dignity. That seems like a big duh moment, but I can tell you, and I'll share this in a little bit later, that is a pretty radical thought in 20th century medicine, because hospice as a practice of medicine is actually relatively new. And we'll get to that in a second. But the second pillar about hospice and why it's more about living than it is about dying is that it's just a full recognition that one's days are numbered, that moments matter, and for you to be fully present in those moments in the last 6 months of your life, which by the way is the physician's benchmark for hospice care, we strive for you to be pain-free so that you can be fully present in those moments, right? Because pain can lead to despair, despair can lead to bitterness, bitterness leads to isolation. And that is the unvirtuous cycle that hospice tries to prevent by treating symptoms. And it's a recognition that moments matter and that you innately deserve to have a pain-free and dignified passing. And it's really a beautiful thing. I'm relatively new to hospice, and I've learned more about living than I have in these last several months than I've learned about dying. And it's really unique. Just by a show of hands, how many of you have personally experienced hospice care with a loved one? Yeah. Okay. So 4 of us. It's remarkable, and I hope to share with you 3 more things here that I think maybe illustrate some of the remarkableness of hospice. So that's number one. Hospice is not about dying, but it's about living, and living to your fullest in the last remaining months that you have here on earth. You know, I mentioned this earlier. Hospice as a medical practice is relatively new. Hospice did not come to the United States until 1974. And prior to that, hospice care, as we understand it now, was happening in London, in Great Britain. Dame Cicely Saunders was a physician who spent much of her medical residency and time observing how patients with terminal diagnosis, and this is in the 1950s, 1960s, and early 1970s, were treated by the national health system. And often, because a patient had received a terminal illness, honestly, they were kind of left to wither on their own. And what she observed is that often patients died alone and in a great deal of pain from their symptoms or lack of symptom management. And literally, she on her own built an entire medical career about treating people after receiving a terminal diagnosis, either from chronic disease or from a traumatic injury, and made a career out of treating those people. So zoom forward to 1972, 1973, the dean of the Yale Medical School hears about the work that's being done in Great Britain and flies over and spends months upon months with Cicely Saunders, and is just blown away by the work that she's doing. Now, on a parallel track, how people reach their end was also a growing social science in psychology and in social work. And so there is a whole parallel body of work going on at that same time in the early 70s that was focusing on how people reached the end of their lives. And so you had this really special confluence of medical and other professions studying this. And so in 1974, hospice was brought to America in Connecticut, and the practice of hospice began, which is really remarkable because I think a lot of us maybe think of hospice care and end-of-life care as really being a part of the medical canon, but it's relatively new. And in fact, hospice came to North Carolina at this very organization in 1978. So my organization, Hospice and Palliative Care Charlotte region, is the oldest hospice provider in the Carolinas. We were incorporated on March 8th, 1978. So just 4 years, really 3.5 years after it came to America. And it was all volunteer run, volunteer nurses, social workers. At that time, it was focused exclusively on cancer patients, and a volunteer oncologist was running hospice. And so that's a point of pride that I'll say here for the Charlotte region, is that we as a community benefit from having the most experienced and time-tested hospice provider in all of the Carolinas. And we go back to the very nascent beginnings of this practice of medicine. So that's number two. Number one, it's not about dying, it's about living. Number two, as a practice of medicine, hospice is relatively new. And number three, and I think if there's anything people remember about today, it's that you have a choice, and your loved ones have a choice in who provides hospice care. Because in 1984, the Center for Medicare Medicaid, in a groundbreaking legislation, agreed that hospice care under a physician's order should be reimbursable under Medicaid Part A and private insurance. And so today, and since 1984, hospice is a benefit that's provided to people with no deductible and very, very little copay. In fact, most hospice providers waive copays because the cost of filing exceeds the amount of money that the organization receives in getting the copay. So you have a choice. And here in the Charlotte area, we are the largest hospice and palliative care Charlotte region. We are the largest provider of hospice care. Novant has a large hospice footprint, and Atrium has a very small hospice footprint. Atrium does a lot of work in Union County, but not a lot of work necessarily in Mecklenburg County. In fact, last year, Atrium referred to us over 2,300 patients for end-of-life care and palliative care. And so we enjoy a very good relationship with Atrium as really their kind of their go-to end-of-life provider. So there is a choice, and that's very, 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 very important. In fact, I was just working with a friend 2 weeks ago who lost their wife, and they had a bad experience with another hospice provider, and that experience was really just born from the fact that once you get into this, you don't really know you have a choice, but you do. And you can choose between us, Novant, Atrium, and even some smaller providers in town that are connected to assisted living or assisted living areas in town. So like Brightmoor down in Ballantyne, their parent company has a hospice provider there. And as a subset of that choice, I'll tell you that you have a choice between nonprofit hospice providers and for-profit hospice providers. And I think they both provide a great service, and you can actually do research and homework on the internet about which hospice provider you think will meet your need, because it's a highly regulated industry, and there are kind of customer service benchmarks that you can research through the Centers for Medicaid and Medicare. I believe it's cms.gov, and you can get to understanding who those providers are. In North Carolina, there are about 30% of the hospice providers are nonprofits, and about 70% are for-profit entities. Nationwide, there's about 4,600 hospice providers across the country, and each have strengths, and each provide good to great and sadly sometimes bad service. So we always encourage people to do their homework and look at their scores, which you can do online. You know, the last thing that I'll mention here, number 4, kind of the fourth important thing I think you should know about hospice care, and I've mentioned it already, but I'll say it again, is that it is covered by Medicare and it's covered by private insurance. And that's a groundbreaking thing for the practice of this medicine that goes back to 1984. But that's an interesting wrinkle for the nonprofit hospice providers, and I'll tell you why. Because even though we do our best in America to provide coverage to people, invariably we find people here in our care. And by the way, we have about 850 people any given day in hospice care, and about 1,100 people in palliative care. But we still find ourselves receiving patients who are underinsured or have no insurance, and are really between a rock and a hard place. They're in their final months of life, but have no means of paying for it. And we don't say no. Just like the YMCA doesn't say no to people who come to its steps, we don't say no to people who need our care. And so as the chief fundraiser for hospice, a large portion of the dollars that I raise is to make sure that the poorest among us get the same quality of care that those with gold-plated health insurance plans get. And it's expensive. I can tell you, through November of 2020, we spent well over $1 million in serving the medically indigent, people who come to us without insurance or are underinsured. But yet we don't skimp, we don't scrimp on our level of care. So what does that mean? That's a real important nuance. We have patients that come to us that may have comorbidities or other diseases that may not be the particular disease that has resulted in their hospice diagnosis, right? They may have cancer, but may also be suffering from other unique medical conditions for which they're on expensive prescription medication. But it's the cancer diagnosis that's their terminal diagnosis. Some hospice providers will only cover care under the cancer regimen, but yet that Parkinson's medication or that other medication is important to maintaining that quality of life those last 3, 4, 5 months. We are going to pay for that, even though those other prescriptions may not be medically reimbursable, right? So essentially, we're going to go out of pocket thousands of dollars treating patient X to make sure the full spectrum of their medications are maintained, when perhaps Medicare or insurance will only reimburse a portion of those medications. So that's that expensive nuance of being underinsured. And that's something to definitely consider when choosing a hospice provider for a loved one. The last thing I'll say is that we specialize in what the industry calls specialty populations, and so the three in that category would be veterans, and we have a whole parallel track that works with our veteran population to make sure that their service to the country is honored by their hospice provider. To the extent their family would like that honored. That includes visits from other veterans, pinning ceremonies. In 2021, we're launching a big push on Vietnam War veterans because so many of them are reaching their age. The second one is a pediatric program called Kids Path, and so we serve about 40 to 60 kids a year that are faced with a terminal illness, and it's a very specialized work dealing with families, loved ones, as well as the pediatric patient themselves. And so it takes a very tender white glove approach on pediatric hospice care. And then the third one is memory care. And so we have special training in dealing with folks that have dementia in its various forms, or Alzheimer's. And so those are all specialty populations. And so those are really, y'all, that's the four main things that I think everybody needs to know about hospice. We'll face it with a loved one at some point, and we may face it with ourselves. It's not about dying. It's about living your last moments to the fullest. That it's a relatively new practice of medicine in the United States. But it's one that is reimbursable under Medicare and private insurance. And then the fourth thing is that you have a choice in who your hospice provider is. And that choice is here in Charlotte, but it's also, if we've got loved ones elsewhere around the country, you'll have a choice in who provides the care. So I've thrown a lot at y'all, and I'm happy to answer any questions. And then I'll end it with a little plug.
I have a question.
Yes, Pinky.
When Mike was in the hospital, we were approached by a palliative care person who was wonderful. He did not get out of the hospital. He went to rehab and then died. But what is palliative care? Yeah,
palliative care, that's a great question. It's a great distinction because the lines are a little fuzzy. Think of it, so palliative care is a lot like hospice in the sense that these are patients that are faced with chronic disease or an illness that may result in a eventual terminal diagnosis, but aren't necessarily inside of the 6-month window. To be enrolled in hospice, it takes the sign-off of 2 physicians. It's the opinion of 2 separate physicians that you have 6 months or less to live. Palliative care, which is also reimbursable under Medicare Part B, is about symptom management while you are still pursuing a curative path potentially. So you can have concurrent care. You can have palliative care, which is about symptom management, about allowing, it's those tools that allow you to live your fullest life, while perhaps at the same time you're getting chemotherapy or something that is what's called curative medicine, that the hope is that you could emerge from some tunnel of time and be either in remission or cured from this chronic disease. So think of it this way. Hospice care is a subset of palliative medicine. And the difference being you are now in the terminal stage as of two physicians' opinions. So what happens when you're at hospice, what happens for a lot of people is they start in the palliative phase and they're pursuing symptom management and curative treatment at the same time. And at some point, a decision is made by the care provider that curative treatment is no longer effective, and you cruise on palliative care and you reach the stage where you transition under hospice.
Thank you very much. Thank you.
Yeah. That's a great question, and it's a little confusing, but it's hopefully a question that when we're dealing with loved ones or potentially ourselves, these are questions that you can ask your physician, because again, it's about living. It's about being free from pain in those precious moments.
I've had experience on both fronts, and plus the after effects with bereavement counseling as well. So I feel like I've been through every wonderful place that's offered, and my experience have all been amazing, and really life-changing in terms of just the quality of care and the communication, which I think to me was probably the most amazing thing. Just that other layer of somebody that you can call at any time, for the most part at any time, that can be that intermediary, is huge. And particularly because I've experienced this in the midst of COVID as well. That was a big game changer for me, because in the middle of COVID, I had to call in hospice, or and it started out with palliative care, and you just never know. So it's okay to call. It's definitely talk to your physician if you have any questions, like if you think possible, because you don't really know. There are some guidelines that are followed, but they are a little gray in the beginning, and for some of us who don't know a lot about it, I feel like I'm more experienced with it now, but when you're questioning whether sometimes it's going hard to go at it alone if you're treating, working with a loved one. So it is just a nice layer of another person to communicate with, to walk you through and to be there and say, what about this? What about this? And then for them to help you set stuff in motion for the comfort of your loved one, whether it's, bringing in the hospital bed that might be necessary, or the medications, or there's just so many levels of assistance that make life easier for those of us who are dealing with these inevitable things around our world sometimes. So, and again, then the bereavement piece afterwards is really phenomenal too. So that's kind of another layer of it that's pretty incredible.
One question that we get a lot about hospice care in particular, because I'll say nearly all palliative services are provided to patients in their home or in their alternative residence. If they're in a retirement community like the Cypress or elsewhere, we go to you. That's the big point, and because it's all about you and it's all about your comfort. But people receive hospice care in one of three settings. A vast majority of people prefer to have hospice in their home, and so that is many of our patients' first choice. Overwhelmingly, 2/3 to 3/4 of the patients that we have in hospice. And I said earlier, we have, as of today, we have about 853 patients. Vast majority receive it in their home. And that means we bring the equipment to you. And the equipment is on loan in your house, and then we'll come get it when care is ended. Patients also receive it in alternative residence settings. And so if, like I've mentioned, Brightmoor or the Cypress, where maybe you have progressive opportunities of residence at centers like this. From I'm living in a condo or an apartment with my spouse, and then maybe I go to kind of a skilled nursing as my health deteriorates, and our nurses and staff go into those residences and serve patients there. And then the third place is our standalone, what we refer to as hospice houses or inpatient units, IPUs. And our organization, which has a 23 county reach between North Carolina and South Carolina, we have 6 standalone facilities where when symptom management becomes too difficult to accomplish in the home. And what I mean by that is maybe it's very difficult to get pain symptoms and other symptoms under control in the house. We can bring patients to our IPUs, and we have very large, comfortable suites where we take care of patients there. We also have what's called respite service. And so if you are an exhausted caregiver and you want to get a break for a weekend, we can work with you to bring your loved one into our IPU where there's 24/7 nursing care. It looks and feels kind of like if the Ritz-Carlton did a intensive care unit wing of a hospital. That's what our IPUs look and feel like. Then we can take your loved one for 2 or 3 nights for respite care to give you as the caregiver a break. And so those all happen at our IPUs. So those are the 3 areas where people get care, but overwhelmingly it's in the home is what people prefer. So
Thomas, how long is hospice care available to a person? Is there a time limit?
Yeah, there is. The time limit, in a way. So there's 2 ways of answering that. So the initial diagnosis is 2 physicians concurring that you or your loved one are in your last 6 months of life. Now that's highly subjective, but that's the Medicare private insurance benchmark, right? To enroll somebody in hospice care. But it's a rolling understanding of care. So in other words, if you're in there at 6 months and your loved one is still alive, no one is kicking out. No one's kicking your loved one out of hospice care. And so it's a diagnosis that's under constant review. So there really is no there's really kind of no ceiling to the care, if you will. You can kind of keep re-enrolling at a physician's prescription, if you will.
Okay, thank you.
I can tell you the average time that someone is with Hospice and Palliative Care Charlotte region for the last 5 years has ranged between 85 days and 91 days. Is the average. Now we will see a big shift in that because of COVID, because COVID has delayed the diagnostics, if you will, of diagnosing someone or being able to write a prescription, if you will, for hospice care. People are waiting longer to see the physician, and so we will see that average dip, I think, dramatically when we aggregate our 2020 numbers, because people are coming to us and a lot of times passing within a week. because they stayed at home for a number of reasons, and largely it's been fear of COVID, and getting in to see their physician. That's been one of the challenges, certainly, that we faced in serving the community through COVID. Kathy, that's a great question.
Thank you.
Yeah.
Have any other questions about the service, or how things work for town before we move on to a yummy conversation?
Yeah. Well, listen, Jane has all of my information, and so Jane, if you wouldn't mind just sending it out, after the call, I'm happy to. What's that?
Did you want to talk about the fundraiser?
Yeah. Oh, yeah. I'm going to do that now.
Okay.
But as far as any clinical related questions, or hey, my neighbor, I think my neighbor is, could probably use palliative care, hospice care. Please don't hesitate to reach out to me directly, and I'll get you. I am not obviously part of the intake team or part of the clinical team, but I'll get you to the right people. And we handle those all the time. I could never overestimate the number of people that come to my colleagues that are about a neighbor, or it's about my father-in-law's brother, who lives in Louisville, and I think he could use hospice, and we'll connect you to the right resources. But I mentioned that we're the largest hospice provider in the Carolinas, and we're one of the largest nonprofit hospice providers. And each year we put millions of dollars back into the community to serve Charlotte and the surrounding areas through a number of things. Millions of dollars are spent in uninsured and underinsured people to make sure that they too can die with dignity. We do free grief counseling for the entire community. You don't even have to have had or been a part of our services. You might have gotten hospice services through Novant, or you may have just suddenly and tragically lost a loved one and you need to talk with somebody. Well, we provide free bereavement services to anyone who needs them, regardless of age or circumstance. We also fund and subsidize our pediatric care, which is very expensive. But we make sure that those services are provided to everyone who needs it, regardless of age, diagnosis, or their ability to pay. And then lastly, we invest in those special populations and additional training so that our veterans and our neighbors with memory care issues get the white glove treatment that they deserve as well. And that's just a handful of things we do. I guess I'll mention the last one. And it's actually great because it's in partnership with the YMCA. And every October we do a grief camp, a survivors camp down at Camp Thunderbird. Because a lot of times loved ones that pass have a child in the home. And so if a child has lost a loved one, a sibling or a parent, they're automatically invited for free to our camp called Chameleon's Journey. And it's a weekend camp down at Camp Thunderbird on Lake Wiley, free of charge. And every October we serve between 70 and 100 kids that come to this camp. And it's about just giving them a breath of fresh air and some fun in the woods away from the sadness that's defined their life. About half the kids are kids that are connected to Hospice and Palliative Care Charlotte. And then the other half are outreach from school guidance counselors from CMS. So if there's a child in CMS who's lost a parent or a loved one, we bring them into our camp too. And so all of that's offered to the community free of charge. And so when people make a gift to Hospice and Palliative Care Charlotte, we'll take those gifts, and those are some of the things we do with it. One of the ways that we raise the money is this thing called Soup on Sunday. And this is where I'm going to ask for your help. COVID has really put a crimp on us, but we get really 19 of some of the best restaurants in Charlotte for the last 21 years make their signature soups in winter. and donate the soups to us, and we in turn sell them to the community at $20 a quart. And these are restaurants like Sante, Barrington's, Dogwood, Dressler's, really some of Charlotte's culinary elite who are so supportive of our mission that they donate their soups. And you can go on our website and you can see what restaurants are participating and the 14 soups that we have offered this fall. And so the help that we could use is to spread the word and have people pre-order their soups. And we're running a drive-through this year. So you order a soup, it'll be bag tagged and ready to go for pickup on February 21. And majority of the proceeds of that will come support our mission.
So I'm a veteran Soup on Sunday person. You know, before we were in this place, Soup on Sunday was an in-person event with tastings of all of these different restaurants, and it was a big gathering with a lot of people. It was a lot of fun, and you could go around and taste everything. Not a really good idea in the middle of COVID, obviously. So this plan is great too, but so good, like such a neat experience, such delicious soup. So I encourage you to support the organization, grab some soup. I promise it's going to be delicious. And then when we get back to normal, hopefully they'll kick back in I mean, this is an annual event, and I just hope you remember it from year to year, because it's besides the fact that I love this organization and I feel like it can touch everybody's life in such a positive way. It's also really good soup, so, you know, and it's winter, and, you know, who doesn't want like a meal, you know, a heartwarming meal. So go on the website. I've shared it in my email. Please send it to your friends. Please spread it around. Please reach out to me if you have any questions. But like I can't say enough about, like, the soup's really good, but the organization is just amazing. So
I've been to Soup on Sunday as well. My friends and I all have loved it for many, many years. The pottery, bowls that are sold there are beautiful, beautiful, beautiful pieces of artwork. And I love the event. I hope it'll be back in person next year. It's always been one of my favorite winter events. I'm sorry you're going to miss it this year, but I'm putting my order in. And Tom, I also put it on my Facebook page to let my friends know about it.
Well, thank you, Kathy. Yeah, I was going to ask if y'all are part of book clubs or church groups, or any other pockets of community that you interact with. It would be great.
Next door.
Next door, exactly. Yeah, next door. And you know, I'll tell you, in the public schools and at the Harris YMCA preschool, February is Kindness Month. It's a month where elementary age children they try to de-emphasize Valentine's Day as just another day to get and receive. And it's a month of giving. And I can tell you that my family and we've been buying soup for all of our neighbors as an expression of kindness in the month of February. And so my encouragement to all of us is to keep the kindness going. And if you're motivated to do that with a quart of soup, just know your efforts will go to a good cause.
That's fabulous. Kathy, yeah, thanks for reminding me about the pottery too, because I believe that's offered as well on the site. And if you weren't aware of it, it's definitely something to take a look at if you enjoy pottery. So yeah.
Well, listen, y'all, it has just been such a pleasure to see each of you again and to get reconnected with the YMCA in this special way. It's all about relationships, and we're stronger for it. And Jane, thanks for being a great host. I'm going to sign off and let you carry on with new business on the agenda.
All right, Tom, thank you so much.
Thank you, Tom.
Yeah, Pinky?
Sign off. It never occurred to me that you wouldn't give a wonderful, wonderful program. And I am glad it is recorded, because I'm going to tell lots of people about it.
Oh yeah,
well,
yeah. It'll be up. So just a reminder, this goes up onto where all our exercise classes are. So you can direct, and I always share that link. and I will share that link on Monday. So please pass that on. And as we, Tom, if you're gonna sign off, go ahead. I just want to briefly talk about, we're gonna be together again next week.
Okay.
Next week we have an author who's got a brand new book out. And her name is Holly Hughes. Holly has written a book. She is a intuitive healer, and she has written a new book, and it is called Real, Not Perfect. So I'm really excited to be bringing Holly Hughes to you guys to talk about her book, talk a little bit about how, you know, we all just can be our authentic selves, and how to really put that out into the world, and how to be happy with our own authentic self. So I hope you'll join us next week and learn a little bit about Holly's book. And I'm so grateful for all of you to see your faces today. And Tom, thank you so much for joining us. Everybody go get some soup.
Yeah, thanks y'all.
Thank you.
Great seeing
Great
you.
program.
Bye, Joanna.
Thanks, guys.
Bye.
Appreciate it all.
Bye.